joining this session. As people are still entering, I'm just introducing the session, but it is always good to honor those people who are on time. So I decided to wait a few minutes, but not too long, as said, because we have a very interesting program. And for a start, I would like to introduce the program and introduce the work of the working group. Let me see, that should be this one, yeah. The working group of the OCI exists in varying compositions of about 30 people, with a board that meets, let's say, three times a year before the working group session, and in the working group sessions, which are 3 times digital per year, and 1 face-to-face, like this session, usually during the annual days. We discuss the process of various projects, which will also be presented later on here. And if you are interested to join the working group, you see the mail address of Inge Eekhout, who is our assistant, and feel free to contact her if you are interested to participate. We cooperate in various research projects, have topics on socio-economic consequences, and work closely together with the European Fair Pricing Network, and participate in a number of European projects. I will further go into that. Health economics or cancer economics is a very increasingly important project, and we have chosen 2 priorities, which is reimbursement and pricing policy, and that is clear that the economic burden for health systems and hospitals of the high-priced drugs and sometimes consequences for patients of those high prices are increasingly an issue. And we see access issues, which will also be dealt with tomorrow in the inequalities session in various European countries. And it is good to be aware of the complexity of access, because you have EMA registration, you have the national coverage, but you also have guidelines within every country, and being able to have your treatment covered does not necessarily mean that patients also receive the treatment, which will also be shown tomorrow, and that is also one of the projects that we were engaged to. Interestingly, I would also draw your attention to the Cancer Pulse site. That is a site from the European Cancer Organization in which you see all kinds of comparisons and inequalities over Europe in terms of access to drugs or access to certain facilities. When it comes to access to treatment, we have a number of projects going on. One is a country-specific project on performance in terms of managed entry agreements and actual drug pricing differences. This project was presented a number of times in the working group meetings, will not be dealt with today, but we hope to be able to submit a publication on this topic within a few months. But we also have a project on actual drug pricing. I will come back, and that will be presented later on. And in the coming years, we have 2 main topics in cooperation with the European Fair Pricing Network, which is a network sponsored by 11 cancer charities from Europe, in terms of developing a transparency and equity index involving countries, treatments and pharma, and enabling organizations and associations to lobby within your own country and within the European Union on improvements in this field. And we will deep dive deeper into the underlying costs of expensive drugs, for instance, in drug development costs, and we will invest in projects in improving purchasing policies. So if you are part of the working group, that will be presented there, and usually you are able to participate in projects, often also as a co-author if you have a significant contribution. Another issue is how you can contribute from the database and the data that are increasingly and interestingly available in your own hospital. We know real-world effectiveness can really differ from trial-based results. We see increasingly that drugs are introduced with surrogate endpoints or based on small-numbered or one-arm studies. And an issue is how to mine these increasing databases, and we call them data lakes, also from a technical point of view recently, and how to use these data to inform and to strengthen technology assessment discussions. That two presentations today from the OncoValue project will deal with this issue, and might also, and we have at least one presentation that is rather practical, so to see what are really the issues from a practical point of view of using those data, which is not an easy matter. Then we will come into economic aspects of early detection and screening. This is increasingly a field that is seen as important as, well, one of the Harvard economics that was presenting a few years ago in one of our sessions said, you are dealing with those expensive drugs, but these are always at the end of the pipeline. Why not invest in early detection and screening that will prevent these very difficult discussions? Whether it is so easy, that is, I think, not the case, but he had a point. So this will be presented related to the Cost Intercept program. And the last issue today is a presentation from Michael Schlander on socioeconomic consequences of cancer. The task force on socioeconomic consequences related to the working group had an exercise the last 2 years in defining, diving deeper into definitions and taxonomy, and also defining a development agenda on this somewhat neglected field in Europe. And we feel that, especially after having been able to publish this in the Lancet Oncology recently, the OCI is very good positioned to add or to aid in setting the agenda on a European level on this topic, and Michael Schlander will discuss about it. So here it is what we think to do. We try to further raise interest by having surveys on socioeconomic consequences in 15 European countries. This is on the review presently. We have a publication almost finalized on a subset of the same study on IAS, with a survey on specific services for young and adult cancer patients. And we are dealing with the question, what instruments are valid and reliable to make proper inventories. We also reach out to the EORTC, who is also active in this field. And we think that the coming years, both in terms of better describing the issue, method development, but also investing in treatment or guidance strategies accompanying the primary treatments, are important issues to deal with this point. And as said in the OCI board yesterday, we also decided that together with the President, we will take steps also to lobby towards the EU Commission for formal programs related to this topic, enabling OCI also take a leading role in this field. So this is the overview of the program today. We will start with the presentation on transparency of cancer medicine prices and rebates, then have 2 presentations on working with real-world data, the HTA approach of early detection for oral cancer, and then Michael Schlander will end with a presentation and discussion on the OCI task force on socio-economic impact. I will give the floor to Sabine Vogler and Nora Franzen.